Hello, my name is Sheridan Evans, and today I will be presenting on the impact of the COVID-19 pandemic on child abuse and neglect reports in Oklahoma. Oklahoma has been significantly impacted by the COVID-19 pandemic, at one point ranking number 4 in the nation for COVID-19 positivity. Since then, this pandemic has had an unprecedented impact on the health of our pediatric populations. School shutdowns, stay-at-home orders, and increased rates of unemployment among families brings concerns for increased rates of malnutrition, anxiety and depression, and specifically child abuse and neglect. In 2018, Oklahoma was ranked number 9 in the United States for most cases of children who are confirmed by Child Protective Services as victims of maltreatment. Therefore, this matter is of particular concern in our state. The majority of child abuse reports in Oklahoma in 2017 were made by law enforcement, child welfare staff, relatives, schools, and hospitals. Because this pandemic has resulted in less interaction with many of these professionals, there is concern for decreased rates of reporting child abuse and neglect. To determine if there has been any change in such reports and allegations, we compared surveillance data of alleged physical and sexual child abuse and neglect in Oklahoma between 2017 and 2020. Oklahoma Child Welfare Services provided surveillance data for each county from July 2017 through June 2020 of alleged physical and sexual child abuse and neglect. Using economic forecasting models via autoregressive integrated moving average algorithms, we predicted the values for the months of February through June of 2020 as if the COVID-19 pandemic and stay-at-home orders had not occurred. We then assessed the difference between the surveilled cases reported to Child Welfare Services and the predicted values. Finally, we applied risk ratios and percent relative effect calculations to the county-level data. Our results show that as of May 2020, there was a significant difference between the expected number of reports and the actual number of allegations reported to Child Welfare Services, a deviation of 26.2%. Reports of physical abuse were 38% lower, and reports of neglect were 25% lower than predicted values for May, both of which remain significantly lower than expected in June. Additionally, reports of sexual abuse in Oklahoma were 39% lower than predicted for May. Our results also showed that the impact of COVID-19 disproportionately affected rural counties across Oklahoma. Overall, we found that rural counties were actually less likely to have decreased reporting of child abuse. However, they were more likely to have larger decreases in places where lower reporting occurred. Rural counties were actually over 5 times more likely to experience a 75% decrease in reporting. In fact, 20 rural counties experienced a 100% decrease in reporting compared to 0 urban counties. In summary, despite the 3-year trend of increasing child abuse and neglect reports in Oklahoma, our results showed a significant decrease in total reports and allegations from the anticipated numbers, along with rural counties being disproportionately affected. The pandemic provided a perfect storm of increased risk factors for abuse, decreased protective factors, and most importantly, it effectively isolated children from adults outside the home, including those who most commonly report abuse and neglect in Oklahoma. Considering these factors and the predicted number of reports for May and June of 2020, the significant decrease in reports and allegations is cause for concern of underreporting, rather than decreased rates of child abuse and neglect. The consequences of the pandemic put Oklahoma children at increased risk for unreported child abuse, and thus adverse childhood experiences, which can result in risky health behaviors, chronic health conditions, difficulty functioning at school and work, and even early death. Possible primary prevention options include ensuring access to the programs that mitigate the risk factors of child abuse, including programs for food insecure families and access to mental health services, especially for those in rural counties. Overall, because the current systems in place have been disrupted by the pandemic, it's imperative that we adapt our systems quickly and provide swift intervention to ensure the safety of our Oklahoma children. Thank you for your time.